Good afternoon, everybody, and welcome to the second instalment of the Widex Tinnitus webinar series. My name's Sam Whiteley, and I am the Business Development Manager for Widex in Australia. I will be taking you through this webinar today. At Widex Australia and New Zealand, our mission is to be the preferred choice for independent hearing aid providers. This vision drives every aspect of our work at Widex. We take great pride in introducing innovative ideas and strategic initiatives that empower independent clinics. We believe that addressing tinnitus presents a unique opportunity for clinics to set themselves apart. By focusing on tinnitus care, we aim to unlock substantial growth opportunities for independent clinics partnering with Widex. That's why we're so enthusiastic about launching this webinar series. This webinar series has been endorsed for CPD points by Accord, A, and New Zealand Hearing Care Professionals. There will be a link as shown here, again at the end of the webinar, for A members to access the mandatory quiz. For the New Zealanders attending, please contact Brent for a certificate after the final webinar. In the first of this webinar series, Brent detailed how offering tinnitus services through your clinic makes good business sense. It allows you to differentiate from larger chains. It can drive lead generations and enhance revenue streams. It can establish your practice as a leader in hearing health. He also introduced the concept of in-clinic care using the Widex Zen therapy and outside clinic care using the Mind-Ear Tinnitus Relief Program. This workshop today expands on the WZT program to address the challenges in providing tinnitus care. I will take you through what the WZT comprises of, and then how to apply this in your clinic for effective tinnitus management. The following webinars on the 19th of Feb and the 26th of Feb will look at topics around amplification and the use of fractal tones. And then for our final webinar, Matthew from Mind-Ear will take you through the exclusive Mind-Ear Tinnitus Relief Program and how it can help you and your clinic in offering exceptional tinnitus support to your clients. In webinar 1, Brent introduced the concept of the Widex approach to tinnitus care. This is a flexible approach designed to suit your preferred model, whether you choose to deliver in-clinic tinnitus care yourself or outside tinnitus care using the Mind-Ear Tinnitus Relief Program. At the heart of this approach are our Widex products featuring Zen technology. Our Widex hearing devices are the most capable at being able to deliver tinnitus support to your clients. We are then supporting our technology with two structured approaches. Our in-clinic program integrates Widex amplification with the comprehensive resources of the WZT program. And we now have an outside clinic option, which connects your clients with tinnitus experts through the Mind-Ear Tinnitus Relief Program. Today, I'll be focusing on the in-clinic component, which is the WZT program. The Widex Zen Therapy program is a proven and research-backed program that addresses tinnitus treatment in a very structured manner. This program is designed to work exclusively with Widex hearing devices, as we are the only manufacturer using fractal tones for sound therapy. The main focus here is to ensure that the client's quality of life is improved through habituation and relaxation techniques. Over time, the Widex WZT program has evolved significantly to what it is today. So the WZT program has been set up to consist of 5 easy-to-follow steps. These steps are the intake process, establishing a treatment plan, utilizing the components of WZT, then assessing the progress of your client, and then follow-up. This is the structure that we use with our tinnitus clients through their management journey. Let's now have a look at each step in detail, and we'll start with the intake process. So step 1, the intake process, consists of several elements. These elements are, firstly, we administer the WZT intake questionnaire. This questionnaire helps us to understand our client and unpack some of their tinnitus disturbance. We then use the TFI or THI. These give us great subjective assessments of our client's tinnitus impact, and they also serve as a baseline measurement for future comparison. We then have our audiological evaluation, and then we finish off with an interview. What we'll do now is we'll look at each element separately. So the intake questionnaire can definitely form the basis of your initial understanding of the impact tinnitus is having on your client. What I recommend is getting the client to complete this in a non-rushed manner. To achieve this, either have the client attend 15 minutes prior to the appointment or have them complete it even days prior to attending. Having them completed a day or two in advance can really assist in preventing the client's focus being on their tinnitus at the start of your appointment. I recommend the questionnaire should be used for all participants. And you can use the QR code on the screen to download a copy of this questionnaire. The next element is to establish a baseline measurement of tinnitus. We do this so that we can plan our program, but also so that we can test throughout the process to gauge the effectiveness of our treatment. So as I said before, we use the TFI or the THI for this. You can use the QR code on your screen to download a copy of the TFI. The next element of the intake process is the audiological evaluation. So as part of this, we have our standard audiological tests. We have tinnitus-specific tests. We have high-frequency audiology if indicated, and then we have observance of any red flags to look out for. The tinnitus-specific testing is sometimes used to supplement the standard audiological battery. The two most common, I find, are pitch matching and loudness matching. These can definitely provide validation to your client's acoustical experiences. They do not actually form part of the WZT, so they're not mandatory. However, they can be valuable. High-frequency audiometry can be considered if your client's thresholds are normal, up to 8K. Again, not mandatory. However, they can paint more of a picture for you and the client. Red flags to look out for can include your normal audiological red flags, but then also red flags around the psychological side of things. The final step of the intake is the interview. So at this step, you're reviewing and bringing together all of your test results. Most clinicians will use this interview as an opportunity for the client themselves to discuss their thoughts and also their concerns. It's also a great opportunity where the clinician can provide some appropriate reassurance. So this can be informally, where you start to provide some basic informational counselling. And what we'll do later in the webinar today, we'll look a little bit at the counselling much more in depth. So step one done is the intake process. Step two is establishing a treatment plan. To establish a treatment plan, we must fulfill three separate elements. And these are determining the tinnitus disturbance level, identifying the WZT components that we want to use with our client, and then step three, which is establishing realistic treatment goals. We're going to look at these in a bit more detail now. So to establish the tinnitus disturbance level, we're actually going to be using the TFI score from our intake process. The TFI will be given a score from 0 to 100 as a percentage. We use this score to rate the client's disturbance level from 1 to 5, with 1 being a minimal level of disturbance, right up to level 5 being very severe. You can see on your screen there, the values assigned to the relative disturbance levels 1 through to 5. Now that we know our disturbance level, we can then move on to identifying the WZT components we need for our client. For each disturbance level, we have specific elements that we recommend. We find the higher the disturbance level, the more components we need to make available to our client. Each of these components will be discussed in greater detail in today's webinar and also the webinar next week with Ian Morby. What I want to do now is take a closer look at the levels and the components that are incorporated. At level 1, the mildest disturbance level, we find that the client will most likely benefit sufficiently from instructional counselling and amplification, if indicated. Zen and sound relax can also be incorporated when the client's in quiet areas. Level 2 includes the addition of adjustment-based counselling and also the addition of some relaxation strategies. As you can see, each successive level starts to build on the WZT recommended components. Level 3, in terms of WZT components, starts to recommend the possible addition of cognitive behavioural intervention in the counselling, or CBI. We're also looking at techniques including avoidance of silence and relaxation exercises as needed. Level 4 builds further on the WZT components by increasing the frequency of components used. At this level, the key to achieving success with your client is the counselling component by far. The 5th level is categorised as very severe. Clients will possibly need intensive CBI and regular relaxation exercise. A point I want to make is it's essential to keep in mind that the tinnitus disturbance level does serve as a general guideline and a starting point to help assist in identifying the WZT components that we need. The ultimate decision, I guess, regarding the necessary components should consider all the information that you as the clinician have gathered at the intake process. The final step in establishing our treatment plan is to formulate realistic goals. So these goals will obviously differ from client to client. And as a clinician, don't feel as if they have to be or should be limited to just tinnitus itself. So some examples can include improving sleep patterns, improving the client's concentration in certain areas, improving their ability to relax in certain areas as well, and also decrease attention to their tinnitus as well. I find that the use of the Cozy T here is a really great way of capturing some of these goals. This is an example of the Cozy T. So it's a modified version of the Cozy that looks specifically at tinnitus-related goals and also improvement in that area. So we've done step 1 and step 2. So now we're on to step 3. Step 3, in terms of the actual WZT, is utilizing the components of the WZT. This is a really crucial part of our treatment plan. So this is where we actually move from planning into actually implementing our management plan. WZT at its core is made up of 4 key components, and these are counseling, amplification, fractal tones, and relaxation strategies. I'll be concentrating on counseling and relaxation strategies today. Ian Morby will cover amplification and fractal tones in next week's webinar. It's important to remember here that the purpose of the WZT is to address all 3 dimensions of tinnitus distress. And these 3 levels are auditory, attention, and emotion. So let's look at how we can achieve this through counseling. Ultimately, our goal here with counseling as clinicians is to help our clients achieve well-being and improve their quality of life. It's important to educate your clients that this is not a quick fix and can require time and commitment on their behalf. We really need to set realistic expectations. This can also be a very empowering experience for the client, so it's important to acknowledge that they are definitely a part of this journey. I also find that it actually can be quite helpful to discuss the concept of habituation with your clients. The purpose here, I guess, is to highlight that there are actual behavioral changes here that we are assisting. So for clients, the knowledge that there's a mechanism at work here can really assist in their belief and ultimate success in the program. The counseling component consists of 3 types of counseling, and that is instructional, adjustment-based, and CBI, or the cognitive behavioral intervention. I want to first look at both instructional counselling and adjustment-based counselling. As we can see here, instructional counselling is all about the client learning skills and gaining knowledge. This can actually start at the intake appointment. With instructional counselling, we want to be able to give our client high-level information regarding tinnitus so they can understand it better. For a great deal of our clients, the process of habituation starts with understanding of how tinnitus, the brain, hearing loss, stress, emotion, and attention all interact together. To help facilitate this, we do use our WZT flip chart. This can be found in electronic form by using the QR code on the screen. This flip chart is fantastic. What it does is it addresses topics such as the prevalence of tinnitus, stepping people through the auditory system, giving information on tinnitus in the brain, information on hearing loss, explaining the stress-tinnitus relationship, and it also explains habituation as well. So this is a really great resource to use when taking on the instructional component of the counselling. This is also available in hard copy, so please reach out to your local Widex representative to secure yourself a copy. The second type of counselling in WZT is adjustment-based counselling. With adjustment-based counselling, we as the clinician are wanting to understand our client better. It's not just giving information. What we're doing is we're hoping to help our client gain insights into their tinnitus. This type of counselling is about handling emotions and adapting to life changes. Adjustment-based counselling is more interactive between you and the client as opposed to the informational counselling. It focuses on delving into the identification and correction of maladaptive thoughts and behaviours that the client has associated with their tinnitus. In instances where instructional counselling is not adequate for habituation, adjustment-based counselling may assist. Now, in order to facilitate this type of counselling, we use 3 specific questions to drive this discussion. And as you can see on the screen, these 3 questions are the content question, the confirmation question, and then the effect question. The content question is designed to seek further information from the client. So an example may be, in the intake form, the client has mentioned that they're having sleep issues, but they haven't given us any more detail about that. The second question from us, the confirmation question, is then used to confirm, verify, or repeat the information learnt from the content question, like a follow-up. So using the sleep example, we're actually following up with a verification and specific details around what the sleep issues are and how tinnitus may be impacting these. Then we move on to the effect question. This has helped to determine where the emotional response that's been elicited here has come from. So using the sleep example, we're seeking specifics on exactly how this is impacting the client emotionally and what their responses are to this situation. We can then work on tactics to adjust this response. So this is the foundation of adjustment-based counselling. Okay, the third type of counselling that we do employ in the WZT is CBI. So CBI counselling is very structured, it's goal-orientated, and it aims to manage clients' negative reactions to their tinnitus. CBI is more in depth than adjustment-based counselling. The key here with CBI is to identify maladaptive thoughts and behaviours, but not only that, to replace them with more positive, logical, alternative thoughts and behaviours. What's interesting about the CBI model is that it challenges the theory that situations or events give rise to someone's emotions. What the CBI model proposes is that it's the thoughts that we have about situations that give rise to emotions, and it's not the situation or experience itself. The objective is to remove inaccurate thoughts, anxieties, and fears that have built up surrounding the client's tinnitus. CBI is intended to help people realize the link between thought and emotion. The steps followed when someone may consider using CBI are outlined on this slide. It's one way to go about it. Now, CBI is a very intensive form of counselling, and it is actually often undertaken by mental health professionals and tinnitus coaches and the likes of people like that. What I would encourage people to do is, if you feel uncomfortable with delivering CBI, it's actually best to refer on. One way that you could do this is, in this instance, is using the MindEar Tinnitus Relief Program, because this is a perfect counterpart for anyone considering CBI counselling support. Now, this is something that will be covered in detail by Matthew in webinar 4. As we said, WZT comprises of those 4 main elements. I've discussed the counselling side of things. Now I want to look at the relaxation strategy part of the program. This element consists of behavioural exercises that can be used during the day or to aid the client's sleep. The clinician themselves may inform, train, or counsel their tinnitus sufferer on how to manage their tinnitus. We all know that there is a significant link between tinnitus and stress. So exercises such as deep breathing, progressive relaxation, and guided imagery can serve to help clients to reduce stress and improve their overall well-being. This makes the relaxation component of the WZT a vital part of the program. So many of these tools that we've just discussed can actually be found on the Widex Zen Tinnitus Management app. The app itself has a wide variety of relaxation tools that are readily at your client's disposal. For instance, the app has sounds that your client can use for sound therapy, distractions, and relaxation. When using the app, the client can change between different nature sounds and also Zen sounds. They have the ability to adjust the volume and balance of these sounds, and also set a timer so these sounds can turn off when they're wanting to go to sleep. On top of that, there are specific relaxation activities. These include deep breathing exercises. So these are a guided activity that focus on the benefit of breathing and regulation of the body. We also have progressive muscle relaxation exercises, which is another guided activity that taps into the benefit of muscle relaxation and how it can positively help calm our client. And then we have guided imagery, where it's using imagery to calm and manage stress. There's also sleep exercises to help those tinnitus sufferers experiencing sleep difficulty. And then finally, as part of the app, there's also a learning component that aims to educate the client on their tinnitus and really help, I guess, demystify their tinnitus. The great thing about the Widex Tinnitus Management app is that it's accessible to your client, or it can be accessed by your client 24 hours a day, 7 days a week. So they can access it when they need to, and they can use it to facilitate relaxation anytime. Now, studies have shown us that most clients will find improvement in their sense of calm and overall well-being within 2 weeks of using the app for as little as 15 minutes a day. So now that we've completed step 3, utilizing the components of WZT, we can now move on to assessing progress of our client, step 4. I find it's essential to assess how our clients are going at all follow-up appointments. I find that in any follow-up appointments, we're going to check in with unstructured questions around the client's progress and general well-being. On top of this, I find we need to subjectively check in by re-administering the TFI. I just wanted to note that it's accepted that a change of 13 points or more in the TFI is a clinically significant change. Keep this in mind when assessing your clients. The final step of the WZT program is the follow-up. The follow-up allows the clinician to check on the client and ensure that the client feels supported throughout the entire program. Now, these follow-ups can be done face-to-face, via Teams, or as a phone call. Now, typically the follow-up schedule would be spaced 2 weeks, 4 weeks, 3 months, 6 months, and 12 months. But that's just a general structure that we put out there. The frequency can change depending on the client and how they're responding to the program. Now, the final tool that Widex has designed is our tinnitus support checklist. This is available via the QR code on your screen now. So this tool has been developed as a simple chronological checklist that you, the clinician, can use to ensure that all of the elements of the WZT have been followed. Okay, so in summary of what we've spoken about today, the WZT program is a proven and research-backed program that addresses tinnitus in a very structured manner. The program is designed to work exclusively with Widex hearing devices, as we are the only manufacturer using fractal tones for sound therapy. The main focus here is to ensure that the client's quality of life is improved through habituation. WZT consists of components that include counselling, amplification, fractal tones, and relaxation strategies. Today, we also looked closely at the counselling and relaxation components. We have learnt that when undertaking counselling in the WZT framework, we are looking to include instructional counselling, adjustment-based counselling, and also CBI. We also learnt that relaxation strategies include deep breathing exercises, progressive muscle relaxation, and guided imagery. We do use the Widex Zen app to help facilitate these activities. In terms of the counselling, I know that there's a lot to unpack with counselling, so we do recommend if anyone has further information or requires further information on counselling, please reach out to us directly because we can definitely help you unpack that further. So in this webinar series, we've introduced the concept of the Widex approach to tinnitus care. The three pillars of this approach are, at the heart, our Widex products featuring Zen technology. Then we have in-clinic care with our Widex Zen therapy program. And then finally, we have our outside clinic care with the MindEar Tinnitus Relief program. We at Widex offer unique technology, which is considered the gold standard for any individual with tinnitus. And this is due to the following features. At Widex, we have the Widex fractal technology encompassing Zen. And these fractal tones and sound relaxed tones are available in all Widex devices. Widex Sound Relax itself is used as a relaxation program for those with tinnitus. We also have Pure Sound, which is ideally suited for tinnitus sufferers who wish to hear naturally like they used to, and it's also very suitable for milder hearing losses. Importantly as well, to remember is the Widex technology allows for the amplification of low-level input sounds and supports broadband amplification. This makes it incredibly well suited to tinnitus care and supporting habituation. In today's webinar, we've covered the WZT program and looked closely at the counselling and relaxation components. Next week, Ian and Morby will be delving deeper into the amplification and fractal tone components. WZT forms a pillar of our in-clinic tinnitus solution. Widex can supply you with training and all the tools required for implementation. Please just reach out to us. Our fourth and final webinar will be presented by Matthew from MindEar. Matthew is going to outline our new outside clinic offering, which is the MindEar Tinnitus Relief Program. This program is a 12-week psychosocial program designed in collaboration with the teams at Widex and MindEar. It offers an optional alternative approach should you wish to enhance your tinnitus care in clinic and also outside of clinic, and save valuable clinical time yourself. So join us next week at the same time to hear from Ian Morby. If you do have any questions regarding today's webinar or any of the webinars from the past, please email us at audiology.anz@widexsound.com, or please just reach out to the Widex team directly. Now you should have a link for next week. It was one registration for all 4 webinars. Alternatively, you can actually log into the Zoom webinar platform and you can enter the webinar ID on the screen. I think it's on the screen. Yes, it is. This is just in case you're using a different device or you've forgotten which email you've registered from. Audiology Australia members, please remember to complete your 5 quiz questions following today's presentation. They can be found at the following QR code on your screen. I'll just leave that up there for a second. Okay. And so thank you to everyone for joining us today. I've really enjoyed giving this presentation and we really look forward to seeing you next week. Thank you.